Hello, this is Dr. Grande. Today's question is, what is alexithymia? So alexithymia is a construct, and sometimes it's thought of as a personality construct or a condition that involves difficulty identifying feelings or recognizing feelings or emotions in other people. Alexithymia is not a mental health disorder, but it is a construct we oftentimes see when certain mental health disorders are present. We can think of alexithymia as having both internal and external components. So with the internal component, we see that somebody has difficulty identifying their own feelings, describing those feelings, expressing those feelings. So there's a deficit in awareness of feeling. Also, there's difficulty differentiating between feelings and bodily sensations. We also see a decrease in imagination, and thinking is restricted to more concrete and logical than abstract. It's also noted here that dreams can be affected by this internal component of alexithymia. Dreams are basic and realistic as opposed to having a lot of fantasy. So again, consistent with the decrease in imagination. Also, we see increased impulsivity with alexithymia. Now, as far as the external component, this is a failure to recognize emotions in other people. And just like the internal component, this can be specific to certain emotions. Alexithymia is on a continuum. So someone could have difficulty recognizing sadness or fear, but be able to recognize enthusiasm. So we see that alexithymia can be challenging because it causes suffering, it damages relationships potentially, and also it can hurt careers. So even though it's not a mental health disorder, it certainly has mental health consequences in a number of presentations. We can also think of alexithymia as having two dimensions, cognitive and affective. And this lets us categorize the deficits in terms of thinking or feeling. So on the cognitive side, it's identifying, interpreting, and describing feelings. And on the affective side, it's experiencing and expressing feelings. So somebody could have a deficit in the cognitive dimension, but not as much in the affective, or the opposite can be true. Most times we think of alexithymia, though, we think of deficits being present on both the cognitive and affective dimensions. Now, as I mentioned, alexithymia is not a mental health disorder, but it's often comorbid with specific mental health disorders. We tend to see alexithymia more with narcissistic personality disorder, antisocial personality disorder, borderline personality disorder, and some depressive and anxiety disorders, as well as substance use disorders. There are also a number of other mental health disorders that we see alexithymia to one degree or another. So it's fairly common when we look at all of psychopathology. We believe that alexithymia affects about 8% of males and 2% of females. We know that alexithymia can interfere with mental health treatment. So if somebody has one of those mental health disorders or another mental health disorder and alexithymia, the alexithymia can get in the way of the treatment because a lot of the mental health modalities focus on being in touch with feelings and being able to identify feelings in other people, for example, to build better relationships. So alexithymia obstructs improvement in a number of presentations. So how can we treat alexithymia? Well, if it becomes the focus of treatment, there are a variety of ways that we can address it. A lot of times we think of mental health therapies for alexithymia that focus on feelings and bodily sensations and increasing awareness. So right away, a modality like Gestalt therapy would come to mind. It can also be treated from the other point of view, from one of the cognitive behavioral therapies, like rational emotive behavior therapy or cognitive therapy. So with these therapies, the logical side would probably be looked at first. So really working to identify the thoughts and see how those could be connected with feelings, and from there build awareness to feelings. So with alexithymia, of course, when we talk about the logical thinking associated with it, we're not talking about an increase in logical thinking ability. We're simply talking about a restriction. So the awareness of feelings, that component has a deficit, and all that remains would be a concrete and logical thinking style. The abstract is removed. However, when using cognitive therapy, I still believe in a number of presentations this could be a good match, because you have a concrete place to start with the logical, and then you can move to the feelings. There are a number of other modalities that can be used to treat alexithymia, as well as the disorders that tend to co-occur with it. So alexithymia is an interesting construct. It occurs quite frequently. It may or may not occur along with a mental health disorder, and it may or may not be the focus of mental health treatment. I hope you found this description of alexithymia to be interesting. Thanks for watching.